Regional anesthesia. Welcome back to our channel, folks. Today, we have an informative and essential topic to discuss: regional anesthesia. In this video, we'll dive into the world of regional anesthesia, covering everything from its definition to its importance in modern medicine, the different types, advantages, disadvantages, patient considerations, and even complications and their management. What is regional anesthesia? First off, what exactly is regional anesthesia? Regional anesthesia is a medical technique used to block sensation in a specific region of the body, typically by injecting local anesthetic agents near nerves or nerve bundles that supply that area. This results in the temporary loss of sensation and, in some cases, motor function in the targeted region. Regional anesthesia is commonly used in surgical and medical procedures to provide pain relief and reduce the need for general anesthesia or systemic pain medications. Here are the key points to define, differentiate, and mention common uses of regional anesthesia. 1. Definition of regional anesthesia. Regional anesthesia involves the administration of local anesthetic agents, such as lidocaine or bupivacaine, near peripheral nerves or nerve plexuses to block pain sensation in a specific part of the body. It is used to create a reversible loss of sensation and muscle function in the targeted area, allowing patients to remain awake and alert during surgical or medical procedures while avoiding the sensation of pain. 2. Differentiation between regional and general anesthesia. Regional anesthesia. In regional anesthesia, only a specific part of the body is anesthetized, leaving the rest of the body conscious and functional. The patient remains awake and aware of their surroundings. Types of regional anesthesia include epidural anesthesia, spinal anesthesia, and various nerve blocks. General anesthesia. General anesthesia, on the other hand, involves the administration of medications that induce unconsciousness and a state of complete insensitivity to pain throughout the entire body. Patients under general anesthesia are not conscious and have no awareness of the surgical procedure. It is typically used for more complex surgeries or when regional anesthesia is not sufficient or appropriate. Common uses of regional anesthesia. Regional anesthesia is employed in a wide range of medical and surgical procedures. Common uses include orthopedic surgery. Regional anesthesia is often used for joint replacement surgeries, example, hip or knee replacement, to provide pain relief and muscle relaxation. Childbirth. Epidural anesthesia is frequently used during labor and delivery to manage pain and facilitate a more comfortable birthing experience for the mother. Abdominal surgery. Abdominal surgeries, such as cesarean sections or hernia repairs, can benefit from regional techniques like spinal anesthesia or transversus abdominis plane, TAP, blocks. Peripheral surgery. Procedures involving the extremities, like hand, arm, leg, or foot surgeries, may use nerve blocks or local anesthesia to numb the area. Pain management. Regional anesthesia can also be used for chronic pain management, such as nerve blocks for chronic back pain or complex regional pain syndrome, CRPS. Regional anesthesia is a technique that selectively blocks sensation in a specific part of the body, allowing for pain relief during medical procedures while keeping the patient conscious and aware. It is distinguished from general anesthesia, which induces unconsciousness throughout the entire body. Regional anesthesia is commonly employed in a variety of surgical and medical scenarios to enhance patient comfort and safety. Importance of regional anesthesia in modern medicine. Now, let's talk about the importance of regional anesthesia in modern medicine. Regional anesthesia plays a crucial role in modern medicine, offering a range of benefits that contribute to improved patient care and surgical outcomes. Here are some key reasons why regional anesthesia is highly important in contemporary medical practice. 1. Pain management. Regional anesthesia effectively blocks nerve signals in a specific area of the body, providing excellent pain control during and after surgery. This allows patients to undergo procedures with reduced discomfort and postoperative pain, leading to a quicker recovery and decreased reliance on opioid pain medications, which can have harmful side effects and the potential for addiction. 2. Minimize general anesthesia. Regional anesthesia can often replace or supplement general anesthesia, reducing the risks associated with general anesthesia, such as nausea, vomiting, and the need for postoperative ventilation. This makes it a safer choice, especially for patients with certain medical conditions or those at higher risk for complications. 3. Enhanced surgical precision. Regional anesthesia allows for intraoperative patient communication, which can be vital in surgeries that require the patient to provide feedback or perform specific tasks during the procedure. Additionally, it reduces the chances of unintended movements during surgery, promoting precision and minimizing surgical complications. 4. Reduce stress response. Regional anesthesia can help dampen the body's stress response to surgery, which can have a positive impact on patient outcomes. Lower stress hormone levels can lead to fewer complications and a quicker recovery. 5. Shorter hospital stays. Regional anesthesia can facilitate faster postoperative recovery, leading to shorter hospital stays for patients. This not only reduces healthcare costs but also minimizes the risk of hospital-acquired infections and other complications associated with extended hospital stays. 6. Enhanced postoperative recovery. Patients who receive regional anesthesia often experience better postoperative outcomes. They may be able to eat, drink, and ambulate sooner after surgery, which can speed up the overall recovery process. 7. Reduced risk of blood clots. By promoting early mobility and preventing immobility-induced complications, regional anesthesia can help reduce the risk of deep vein thrombosis, DVT, and pulmonary embolism, PE, after surgery. 8. Improved patient satisfaction. Patients who undergo surgery with regional anesthesia often report higher levels of satisfaction due to reduced pain and a more positive overall surgical experience. 9. Versatility. Regional anesthesia techniques can be adapted for a wide range of procedures, from minor outpatient surgeries to complex, lengthy operations. Anesthesiologists can tailor their approach to suit the specific needs of each patient and procedure. 10. Pediatric applications. Regional anesthesia is particularly beneficial for pediatric patients, as it avoids the potential risks associated with general anesthesia in this population. It allows for quicker recovery and less postoperative distress for children and their parents. Regional anesthesia has become an integral part of modern medicine, offering significant advantages in terms of pain management, safety, surgical precision, and patient satisfaction. Its role in improving patient outcomes and enhancing the overall surgical experience makes it a valuable tool in the arsenal of medical professionals. Anatomy and nerve blocks. To understand how regional anesthesia works, you need to grasp some basic anatomy and nerve blocks. Certainly. Nerves are a crucial part of the human body's nervous system, responsible for transmitting signals between various parts of the body and the brain. To understand the anatomy of nerves and nerve blocks, it's important to grasp some key concepts. Anatomy of nerves. Nerves are composed of specialized cells called neurons. Neurons are the functional units of the nervous system and consist of three main parts. 1. Cell body. This is the main part of the neuron that contains the nucleus and other organelles. It processes information received from other neurons and decides whether to generate a signal. 2. Dendrites. These are small, branch-like extensions that extend from the cell body. Dendrites receive signals from other neurons and transmit them to the cell body. 3. Axon. The axon is a long, cable-like structure that extends from the cell body. It carries signals away from the cell body and toward other neurons, muscles, or glands. Axons are covered by a protective layer called the myelin sheath, which helps speed up the transmission of nerve impulses. Nerves are bundles of these neurons, often wrapped in connective tissue, that transmit electrical signals in the form of nerve impulses. Nerve blocks. Nerve blocks are medical procedures used to temporarily interrupt or block the transmission of pain signals along specific nerves. They are commonly used for pain management, anesthesia, and diagnostic purposes. Nerve blocks involve the injection of local anesthetics or other medications near a nerve or a group of nerves. This prevents the nerve from transmitting pain signals to the brain. There are different types of nerve blocks, including 1. Peripheral nerve blocks. These target nerves outside the central nervous system, typically in the limbs or specific body regions. Examples include brachial plexus blocks for the arm and sciatic nerve blocks for the leg. 2. Central nerve blocks. These involve blocking nerves closer to the central nervous system, such as epidural or spinal blocks, commonly used during childbirth or certain surgeries. Nerve conduction and transmission. Nerve conduction and transmission are processes by which nerve signals are generated, propagated, and transmitted throughout the nervous system. Here's an overview. 1. Signal generation. Neurons generate electrical signals, known as action potentials or nerve impulses, when stimulated. This stimulation can come from sensory input, chemical signals, or other neurons. 2. Propagation. Once generated, the nerve impulse travels along the axon of the neuron. The myelin sheath, which covers some axons, helps speed up the propagation of the impulse by allowing it to jump from one node of Ranvier to the next, a process called saltatory conduction. 3. Synaptic transmission. Nerve impulses are transmitted from one neuron to another at specialized junctions called synapses. At the synapse, chemical neurotransmitters are released from the presynaptic neuron's axon terminals and bind to receptors on the postsynaptic neuron, allowing the signal to pass from one neuron to the next. Nerves are composed of neurons that transmit electrical signals, and nerve blocks are medical procedures that temporarily interrupt these signals to provide pain relief or anesthesia. Nerve conduction and transmission involve the generation, propagation, and synaptic transmission of nerve impulses. Understanding the anatomy and function of nerves is crucial for medical professionals and performing nerve blocks or diagnosing and treating neurological conditions. Types of regional anesthesia. Now, let's explore the different types of regional anesthesia. Regional anesthesia is a type of anesthesia that involves the administration of anesthetic agents to a specific region of the body, rather than inducing general anesthesia where the patient loses consciousness completely. This allows for pain relief and muscle relaxation in a particular area while the patient remains awake or lightly sedated. Here are various types of regional anesthesia techniques. 1. Peripheral nerve blocks. Peripheral nerve blocks involve injecting local anesthetic agents around specific nerves in the body to block sensation and pain in a particular region. These blocks are commonly used for surgeries and procedures involving the extremities, arms, legs, or other specific areas. Examples of peripheral nerve blocks include brachial plexus blocks, for upper limb procedures, femoral nerve blocks, for knee surgeries, and sciatic nerve blocks, for lower limb procedures. 2. Epidural anesthesia. Epidural anesthesia involves the injection of anesthetic medication into the epidural space, which is the space around the spinal cord but outside the protective spinal cord membrane, dura mater. Epidural anesthesia is often used for procedures related to childbirth, epidural analgesia for labor and delivery, and surgeries involving the lower abdomen, pelvis, or lower extremities. 3. Spinal anesthesia. Spinal anesthesia, also called subarachnoid block, involves the injection of anesthetic medication directly into the cerebrospinal fluid in the subarachnoid space, which is a more interior location compared to epidural anesthesia. Spinal anesthesia is typically used for surgeries in the lower abdomen, pelvis, and lower extremities. It provides rapid and profound anesthesia and is commonly used for procedures like cesarean sections and lower limb surgeries. 4. Paravertebral blocks. Paravertebral blocks involve injecting local anesthetic alongside the spinal vertebrae, near the spinal nerves as they exit the spinal cord. These blocks are often used for procedures involving the chest and abdominal regions, such as breast surgery or thoracic surgery. Paravertebral blocks provide regional anesthesia to the corresponding dermatomes. 5. Plexus blocks. Plexus blocks target nerve plexuses, which are networks of nerves that control specific regions of the body. Common examples include brachial plexus blocks, for upper limb anesthesia, and lumbar plexus blocks, for lower limb anesthesia. These blocks are often used for orthopedic and upper or lower extremity surgeries. Each type of regional anesthesia has its indications and advantages depending on the surgical procedure, patient's medical condition, and the desired level of anesthesia. Regional anesthesia offers several benefits, including reduced side effects compared to general anesthesia and improved postoperative pain management. However, it also requires expertise in nerve localization and administration of anesthetic agents. The choice of the specific technique depends on the patient's needs and the preferences of the anesthesia team. Peripheral nerve blocks. Peripheral nerve blocks are a type of medical procedure used to provide anesthesia or pain relief for specific regions of the body by blocking the transmission of pain signals along peripheral nerves. These nerve blocks are typically administered by an anesthesiologist or a pain management specialist and can be used for a variety of medical purposes, including surgery, chronic pain management, and diagnostic procedures. Here's a detailed overview of the process and some common peripheral nerve block sites. Process of peripheral nerve blocks. 1. Patient evaluation. Before performing a peripheral nerve block, the healthcare provider will evaluate the patient's medical history, current health status, and the nature and location of the pain. This assessment helps determine the appropriateness of the procedure and the specific nerves to target. 2. Informed consent. The patient is informed about the procedure, its risks, benefits, and alternatives. Informed consent is obtained before proceeding. 3. Preparation. The patient is typically positioned comfortably, and the skin over the intended injection site is cleaned and sterilized to reduce the risk of infection. 4. Local anesthetic. A local anesthetic is injected into the skin and subcutaneous tissue at the site of the intended nerve block. This numbs the skin and minimizes the pain associated with the procedure itself. 5. Needle insertion. Using ultrasound guidance or other imaging techniques, a needle is inserted near the target nerves. The use of imaging helps ensure precise needle placement and minimizes the risk of damaging adjacent structures. 6. Nerve block injection. Once the needle is correctly positioned, a mixture of local anesthetic and sometimes a corticosteroid, for longer-lasting pain relief, is injected around the nerve. The local anesthetic temporarily blocks the transmission of pain signals, providing immediate relief, while the corticosteroid may offer more extended pain relief by reducing inflammation. 7. Confirmation. After the injection, the healthcare provider may assess the patient to ensure that the intended nerve block has been successful. This may involve testing the affected area for sensation or motor function. 8. Recovery. The patient is monitored for a short period to ensure there are no adverse reactions to the procedure. In most cases, the patient can resume their normal activities shortly after the nerve block. Common peripheral nerve block sites. 1. Brachial plexus block. This block targets the brachial plexus, a network of nerves responsible for the sensation and movement of the upper extremities. It is often used for upper arm, shoulder, and hand surgeries. 2. Femoral nerve block. The femoral nerve block is used to provide pain relief for procedures involving the thigh, knee, and hip joint. 3. Sciatic nerve block. This block is used to alleviate pain in the hip, thigh, and lower leg. It's commonly used for procedures like knee replacement surgery. 4. Intercostal nerve block. Intercostal nerve blocks target the nerves running between the ribs and are used for pain management in conditions like rib fractures or postoperative pain. 5. Axillary nerve block. This block is used for surgeries or pain relief in the shoulder and upper arm area. 6. Popliteal nerve block. It targets the nerves behind the knee and is often used for pain control during foot and ankle surgery. 7. Occipital nerve block. occipital nerve blocks can alleviate headache or neck pain by targeting the occipital nerves located at the back of the head and neck. These are just a few examples of common peripheral nerve block sites, and there are many others depending on the specific needs of the patient and the nature of the procedure or pain condition being treated. The choice of nerve block site and technique will be determined by the healthcare provider based on individual circumstances. Epidural anesthesia. Epidural anesthesia is a medical procedure commonly used in the field of anesthesiology to provide pain relief and anesthesia to a specific region of the body, typically the lower half of the body, during surgeries or childbirth. It involves the administration of anesthetic medication into the epidural space, which is the outermost part of the spinal canal. This medication blocks nerve impulses in the spinal cord, thereby reducing or eliminating pain sensations in the lower part of the body without causing the loss of consciousness, unlike general anesthesia. Here's a more detailed explanation of epidural anesthesia, including its indications and techniques. 1. Indications. Epidural anesthesia is used in various medical situations for pain management and anesthesia, including childbirth. One of the most common uses of epidural anesthesia is during labor and delivery. It can provide pain relief to the lower half of the body, allowing the mother to remain awake and alert while minimizing the pain associated with contractions and childbirth. Surgery. Epidurals are also employed in surgeries involving the lower abdomen, pelvis, or lower extremities. This method can reduce the need for general anesthesia and its associated side effects. Chronic pain management. In some cases, epidural injections are used to manage chronic pain conditions, such as back pain or sciatica. These injections may provide relief by reducing inflammation and blocking pain signals. Postoperative pain control. Epidurals can be used postoperatively to manage pain, especially in cases where the surgical site is expected to cause significant discomfort. 2. Techniques. Epidural anesthesia is typically administered by an anesthesiologist or a nurse anesthetist and involves the following steps. A. Patient positioning. The patient is usually positioned on their side or in a seated, hunched-over position, depending on the purpose of the epidural and the patient's condition. B. Sterilization. The skin over the injection site, usually in the lower back, is cleaned and sterilized to reduce the risk of infection. C. Local anesthetic. A local anesthetic is injected into the skin and underlying tissues to numb the area where the epidural needle will be inserted. D. Needle insertion. A special needle is carefully inserted into the epidural space, guided by fluoroscopy, live X-ray, or by feeling for specific anatomical landmarks. Sometimes, a catheter is threaded through the needle. E. Medication administration. Once the needle or catheter is correctly positioned in the epidural space, the anesthetic medication, such as a combination of local anesthetics, like lidocaine or bupivacaine, and opioids, like fentanyl or morphine, is slowly injected. This medication blocks nerve signals and provides pain relief. F. Monitoring. The patient is closely monitored throughout the procedure to ensure proper pain relief and to watch for any potential complications, such as a drop in blood pressure. G. Continuous infusion or boluses. In some cases, a continuous infusion of medication is maintained through the epidural catheter for ongoing pain relief, while in others, intermittent boluses may be administered as needed. Epidural anesthesia is generally considered safe and effective when administered by trained healthcare professionals. However, it may have potential side effects and risks, including a decrease in blood pressure, headache, infection, or nerve damage. The choice of epidural anesthesia and its specific technique may vary depending on the patient's medical condition and the type of surgery or pain management required. It is crucial for patients to discuss their options and any concerns with their healthcare providers before undergoing epidural anesthesia. Spinal anesthesia. Spinal anesthesia, also known as spinal block or subarachnoid block, is a medical procedure used to provide regional anesthesia for various surgical and diagnostic purposes. It involves the injection of a local anesthetic medication into the subarachnoid space in the spinal canal. This results in the temporary loss of sensation and muscle function in the lower half of the body, making it an effective method for pain control during surgeries or medical procedures below the waist. Here's a more detailed explanation of spinal anesthesia, including its indications and techniques. 1. Procedure. A patient undergoing spinal anesthesia typically lies on their side or sits up, depending on the specific procedure and the patient's condition. The anesthesiologist or anesthetist identifies the correct location for the spinal injection, often between the third and fourth or fourth and fifth lumbar vertebrae in the lower back. The area is cleaned and sterilized, and a local anesthetic is administered to numb the skin and underlying tissues. A thin, hollow needle is inserted through the numbed area into the subarachnoid space, which contains cerebrospinal fluid, CSF, and surrounds the spinal cord. A small amount of local anesthetic, such as lidocaine or bupivacaine, is injected into the subarachnoid space. The needle is then removed, and the patient is positioned properly to allow for the even spread of the medication within the CSF. 2. Indications. Spinal anesthesia can be used for a wide range of surgical and diagnostic procedures, including but not limited to lower abdominal surgeries, example, cesarean section, hernia repair, prostate surgery. Lower extremity surgeries, example, knee or hip replacements. Gynecological surgeries, example, hysterectomy. Urological procedures, example, bladder surgeries. Orthopedic procedures, example, joint surgeries. Some diagnostic and therapeutic interventions, example, myelograms. 3. Advantages. Rapid onset. Spinal anesthesia works quickly, providing almost immediate pain relief. Precise anesthesia. It can be used to target a specific region of the body. Lower doses of anesthetic. Compared to general anesthesia, spinal anesthesia often requires smaller amounts of anesthetic, reducing the risk of systemic side effects. Improved recovery. Patients may experience less nausea and a quicker return to normal function after surgery. 4. Techniques. There are variations in the technique, such as single-shot spinal anesthesia and continuous spinal anesthesia, used for longer procedures or postoperative pain management. The choice of local anesthetic and its concentration can vary depending on the procedure, patient's age, and medical condition. Monitoring vital signs and the patient's response to the anesthesia is crucial throughout the procedure. While spinal anesthesia is generally safe and effective, it may not be suitable for all patients, especially those with certain medical conditions or allergies to local anesthetics. Therefore, a thorough evaluation by a healthcare provider is necessary to determine the appropriateness of spinal anesthesia for a particular individual and procedure. Additionally, as with any medical procedure, there are potential risks and complications, so patients should discuss their concerns and expectations with their healthcare team. Paravertebral blocks. Paravertebral blocks, also known as paravertebral nerve blocks, are a type of regional anesthesia technique used in medical and surgical practice. These blocks involve the injection of local anesthetics or other medications into the paravertebral space, which is located alongside the spinal column, adjacent to the vertebrae. The goal of a paravertebral block is to provide targeted pain relief or anesthesia to a specific region of the body innervated by the nerves in that area. Here's a more detailed description and discussion of their applications. 1. Procedure. During a paravertebral block, a needle is inserted into the paravertebral space, guided by imaging techniques like ultrasound or fluoroscopy for precision. Once the needle is correctly positioned, local anesthetics or other medications are injected into this space. This effectively blocks the transmission of pain signals along the nerves in the vicinity. 2. Types of paravertebral blocks. There are various types of paravertebral blocks, depending on the location and purpose. Thoracic paravertebral block. This is commonly used for surgical procedures involving the chest and upper abdomen, such as thoracotomy, lung surgery, or mastectomy, breast surgery. Lumbar paravertebral block. This is often utilized for surgeries or pain management in the lower abdomen, pelvis, or lower extremities. 3. Applications. Pain management. Paravertebral blocks can provide effective pain relief for various medical conditions and surgical procedures. For example, after major chest or abdominal surgeries to minimize postoperative pain. For patients with chronic pain conditions like complex regional pain syndrome, CRPS, or shingles, herpes zoster, affecting the thoracic or lumbar regions. Breast surgery. Paravertebral blocks are commonly used in breast surgery, such as mastectomy or breast reconstruction, as they offer targeted pain relief without affecting the entire body. This can reduce the need for opioids and improve postoperative recovery. Rib fractures. In cases of rib fractures, paravertebral blocks can be employed to provide pain relief and promote better respiratory function. Labor analgesia. For women in labor, a paravertebral block can be used as an alternative to epidural anesthesia for pain relief during childbirth. Palliative care. Paravertebral blocks can be used to manage pain in patients with advanced cancer or other terminal illnesses, improving their quality of life. 4. Advantages. Precise pain relief in a localized area. Reduced risk of systemic side effects compared to general anesthesia. Faster recovery and shorter hospital stays. Decreased reliance on opioids, reducing the risk of opioid-related side effects and addiction. 5. Risks and considerations. While paravertebral blocks are generally safe, they do carry some risks, including infection, bleeding, nerve injury, and allergic reactions to medications. Proper training and expertise are essential for healthcare providers performing these procedures. In summary, paravertebral blocks are valuable tools in pain management and anesthesia, offering targeted pain relief for a variety of medical conditions and surgical procedures. Their ability to provide localized anesthesia while minimizing systemic effects makes them a preferred choice in many clinical situations. However, their successful and safe administration requires skilled medical practitioners and proper patient evaluation. Plexus blocks. Plexus blocks are a type of regional anesthesia technique used in medical practice to provide pain relief and anesthesia to specific regions of the body by blocking the transmission of pain signals along nerves within a nerve plexus. A nerve plexus is a network of intersecting nerves that control the sensation and movement of a particular area of the body. Plexus blocks are typically administered by an anesthesiologist or a skilled healthcare provider and are used for various surgical procedures or to manage pain associated with certain medical conditions. Here are some specific plexus blocks. 1. Brachial plexus block. The brachial plexus block is used to provide anesthesia or pain relief to the upper limb, including the shoulder, arm, and hand. It is commonly employed for surgeries on the upper extremity, such as hand or arm surgeries, as well as for pain management in conditions like complex regional pain syndrome, CRPS, or certain fractures of the upper limb. 2. Interscalene block. This is a specific type of brachial plexus block that targets the roots and trunks of the brachial plexus. It is often used for surgeries involving the shoulder, including rotator cuff repairs and shoulder arthroscopy. 3. Axillary block. The axillary block targets the axillary nerve and is used for procedures on the forearm, wrist, and hand. It is commonly employed for surgeries like carpal tunnel release or hand surgery. 4. Femoral nerve block. This block is used to provide anesthesia or pain relief to the anterior thigh and knee. It is often used in knee surgeries, such as knee replacement surgery or anterior cruciate ligament, ACL, reconstruction. 5. Sciatic nerve block. The sciatic nerve block is used to anesthetize or alleviate pain in the hip, thigh, and lower leg. It can be helpful for procedures like hip surgery, knee surgery, or managing pain from conditions like sciatica. 6. Lumbar plexus block. The lumbar plexus block targets the lumbar nerves and is used for procedures on the lower abdomen, groin, or upper thigh. It may be used in surgeries like hernia repair or hip surgery. 7. Celiac plexus block. This block targets the celiac plexus, a network of nerves in the abdomen. It is primarily used for pain management in patients with cancer-related abdominal pain, particularly in cases of pancreatic cancer or other abdominal malignancies. 8. Superior hypogastric plexus block. This block is used to manage chronic pelvic pain, often associated with conditions like endometriosis or pelvic inflammatory disease. 9. Stellate ganglion block. Although technically not a plexus block, it targets the stellate ganglion in the neck and is used to treat conditions like complex regional pain syndrome, CRPS, in the upper extremities, as well as some cases of excessive sweating, hyperhidrosis. These are just a few examples of plexus blocks and their applications. The choice of which plexus block to use depends on the specific surgical or pain management needs of the patient, as well as the preferences and expertise of the medical team. Plexus blocks can provide effective pain relief and reduce the need for general anesthesia, making them valuable tools in modern medicine. However, they also require precise administration and carry potential risks, so they should be performed by trained professionals. Advantages of regional anesthesia. Regional anesthesia is a medical technique that involves the administration of anesthetic agents to a specific region of the body, effectively blocking the sensation of pain in that area. This approach offers several advantages compared to general anesthesia or other pain management methods. Here are some of the key advantages of regional anesthesia. 1. Reduced systemic effects. Regional anesthesia primarily targets a specific part of the body, which means that the rest of the body remains largely unaffected by the anesthetic agents. This reduces the risk of adverse systemic reactions and minimizes the impact on vital organs like the heart, lungs, and liver. 2. Less risk of respiratory complications. General anesthesia can sometimes lead to respiratory problems, such as postoperative pneumonia. Regional anesthesia eliminates this risk because the patient remains awake and can breathe independently during the procedure. 3. Lower risk of nausea and vomiting. Nausea and vomiting are common side effects of general anesthesia. With regional anesthesia, these side effects are significantly reduced, leading to improved postoperative comfort and recovery. 4. Faster recovery. Patients under regional anesthesia often experience a quicker recovery compared to those under general anesthesia. Since the anesthesia is limited to a specific area, patients are usually able to regain mobility and return to their normal activities sooner. 5. Improved pain control. Regional anesthesia provides excellent pain relief both during and after surgery. It can be used as a standalone technique or in combination with other pain management methods, reducing the need for opioid-based pain medications, which can have side effects and lead to addiction. 6. Enhanced surgical precision. Surgeons benefit from the patient being awake during the procedure because they can communicate with the patient and receive immediate feedback. This can lead to greater precision and improved outcomes in certain surgeries. 7. Stable hemodynamics. Regional anesthesia generally has a more stable impact on a patient's cardiovascular system compared to general anesthesia. Blood pressure and heart rate fluctuations are typically less pronounced, reducing the risk of complications, especially in patients with pre-existing heart conditions. 8. Reduced healthcare costs. Shorter hospital stays, fewer complications, and a reduced need for postoperative care can result in lower healthcare costs for both patients and healthcare systems. 9. Suitable for high-risk patients. Regional anesthesia can be a safer option for patients who are at a higher risk for complications under general anesthesia, such as those with significant comorbidities or advanced age. 10. Extended pain relief. In some cases, regional anesthesia techniques can provide extended postoperative pain relief, allowing for a smoother transition to recovery and rehabilitation. 11. Regional blockade-specific advantages. Certain types of regional anesthesia, like epidurals for labor or spinal anesthesia for lower abdominal surgeries, offer specific advantages tailored to the procedure. For example, epidurals provide pain relief during childbirth without affecting the baby. 12. Patient satisfaction. Patients often report higher levels of satisfaction with regional anesthesia due to the reduced side effects, quicker recovery, and more active participation in their care. It's important to note that the choice of anesthesia depends on various factors, including the type of surgery, patient preferences, and the expertise of the healthcare team. Regional anesthesia is not suitable for all procedures, and its applicability should be determined on a case-by-case basis. Disadvantages of regional anesthesia. Regional anesthesia can be a highly effective and beneficial technique for providing anesthesia and pain relief for surgical procedures or other medical interventions. However, like any medical intervention, it also has its potential disadvantages and risks. Here are some of the common disadvantages of regional anesthesia. 1. Nerve damage. Although rare, there is a risk of nerve damage when performing regional anesthesia techniques such as nerve blocks or epidurals. This can result in temporary or even permanent loss of sensation or motor function in the affected area. 2. Infection. Any time a needle is inserted into the body, there is a risk of introducing infection. Regional anesthesia procedures can potentially lead to localized infections at the injection site, which may require treatment with antibiotics. 3. Bleeding and hematoma. Hematomas, or collections of blood, can occur at the site of the injection. This can lead to pain, swelling, and, in severe cases, may require surgical intervention to drain the hematoma. 4. Allergic reactions. While rare, allergic reactions to local anesthetics or other medications used in regional anesthesia can occur. These reactions can range from mild skin irritation to severe anaphylactic shock, which is a life-threatening emergency. 5. Inadequate pain relief. Regional anesthesia may not always provide complete pain relief, especially in complex surgical procedures or when the technique is not performed correctly. This can result in discomfort or pain during the procedure. 6. Difficulty in placement. Inserting needles and catheters for regional anesthesia can sometimes be technically challenging, especially in patients with anatomical variations, obesity, or other factors that make access to nerves or the epidural space difficult. 7. Prolonged recovery time. Some patients may experience prolonged numbness or weakness in the affected limb or area after regional anesthesia, which can affect their ability to perform activities of daily living and delay their recovery. 8. Limited indications. Regional anesthesia may not be suitable for all types of surgeries or medical procedures. Some patients may have contraindications or medical conditions that make regional anesthesia less safe or effective. 9. Postdural puncture headache, PDPH. When an epidural or spinal needle punctures the dura mater, the outermost membrane surrounding the spinal cord, it can lead to PDPH in some patients. This type of headache can be severe and may require additional treatment. 10. Potential for toxicity. If the local anesthetic is inadvertently injected into the bloodstream or absorbed in excessive amounts, it can lead to systemic toxicity, affecting the heart and central nervous system. 11. Technical skill required. Regional anesthesia procedures require a high level of skill and expertise on the part of the anesthesia provider. Inexperienced practitioners may increase the risk of complications. It's important to note that the benefits of regional anesthesia often outweigh these potential disadvantages, especially when performed by skilled healthcare professionals in appropriate clinical situations. Patients should discuss the risks and benefits with their healthcare providers to make informed decisions about their anesthesia options. Patient considerations. Patient assessment is a critical aspect of healthcare that involves gathering information about a patient's medical history, current condition, and other relevant factors to ensure safe and effective healthcare delivery. It plays a pivotal role in healthcare decision-making, treatment planning, and patient safety. Here are some key points highlighting the importance of patient assessment. 1. Accurate diagnosis and treatment planning. Patient assessment helps healthcare providers accurately diagnose medical conditions. It involves gathering information about the patient's symptoms, medical history, and physical examination findings, which are crucial for determining the appropriate treatment plan. Without a proper assessment, misdiagnosis and inappropriate treatment can occur, potentially leading to harm. 2. Individualized care. Patients are unique, and their healthcare needs vary. Through assessment, healthcare providers can tailor their approach to each patient's specific circumstances, taking into account factors such as age, gender, medical history, and lifestyle. This individualized care is essential for achieving the best possible outcomes. 3. Risk identification. Patient assessment helps identify potential risks and complications associated with specific treatments or interventions. For example, it can reveal allergies, pre-existing medical conditions, or medications that may interact with prescribed treatments. This information is vital to prevent adverse events. 4. Monitoring progress. Regular patient assessments allow healthcare providers to monitor a patient's progress over time. By tracking changes in symptoms, vital signs, and laboratory values, providers can adjust treatment plans as needed to optimize patient outcomes. 5. Informed decision-making. Informed consent is a fundamental ethical principle in healthcare. Patients have the right to be fully informed about their condition, treatment options, risks, and benefits. Patient assessments provide the necessary information for patients to make informed decisions about their care. Now, let's discuss contraindications and precautions in healthcare. Contraindications refer to specific situations or conditions in which a particular treatment, procedure, or medication should not be used due to the potential for harm. Contraindications are based on medical evidence and safety considerations. Examples of contraindications include allergies. If a patient is known to have a severe allergy to a specific medication or substance, it is contraindicated to use that substance in their treatment. Medical conditions. Some treatments may be contraindicated for patients with certain medical conditions. For example, certain medications may be contraindicated for individuals with liver disease. Precautions, on the other hand, are conditions or factors that require careful consideration and monitoring when using a particular treatment or intervention. Precautions are not absolute contraindications but indicate that the healthcare provider should assess the potential risks and benefits more closely. Examples of precautions include pregnancy. Some medications may be used with caution in pregnant women, considering potential risks to the fetus. Age. Certain treatments may require adjustments for pediatric or geriatric patients due to differences in metabolism and tolerance. Concurrent medications. Precautions are necessary when a patient is taking multiple medications, as drug interactions can occur. Known sensitivities. Patients with a history of mild allergies or sensitivities may require precautionary measures when using related medications. In summary, patient assessment is crucial for providing safe and effective healthcare, ensuring accurate diagnosis and treatment planning. Contraindications and precautions are important concepts in healthcare decision-making, helping to avoid harm and optimize patient outcomes by guiding when treatments should be avoided or used with caution. Healthcare providers must be well informed about these aspects to provide the best care possible to their patients. Complications and management. Regional anesthesia is a valuable technique used in medical practice to provide anesthesia and analgesia to specific regions of the body, often without affecting consciousness. While it is generally considered safe, there are potential complications associated with regional anesthesia. Here are some common complications and their management. 1. Nerve injury. Complication. Injury to nerves in the region of the block can result in temporary or permanent sensory or motor deficits. Management. Careful technique, proper needle selection, and continuous patient monitoring can reduce the risk. If nerve injury occurs, early consultation with a neurologist or nerve injury specialist is essential for evaluation and potential interventions. 2. Infection. Complication. Regional anesthesia can introduce bacteria into the tissue or bloodstream, leading to local or systemic infection. Management. aseptic technique during placement, skin disinfection, and prophylactic antibiotics, when indicated, can minimize infection risk. Early recognition and appropriate antibiotic therapy are essential if infection occurs. 3. Hematoma. Complication. Hematomas can form around the injection site, potentially compressing nerves or blood vessels. Management. Adequate hemostasis during the procedure. Careful needle removal, and immediate recognition and evacuation of hematomas can prevent complications. Compression dressings or surgical intervention may be necessary. 4. Local anesthetic toxicity. Complication. Systemic absorption of local anesthetic can lead to toxicity, affecting the central nervous system, cardiovascular system, and more. Management. Monitoring for early signs of toxicity, example, seizures, cardiac arrhythmias, is crucial. Dosing should be carefully calculated and limited to safe levels. Intralipid therapy can be used to treat severe local anesthetic toxicity. 5. Failed block. Complication. Incomplete or inadequate anesthesia or analgesia. Management. Reassess the patient's anatomy, adjust the technique, or consider alternative approaches. Supplemental anesthesia or sedation may be necessary. 6. Postdural puncture headache, PDPH. Complication. PDPH can occur after inadvertent dural puncture during epidural or spinal anesthesia. Management. Conservative management includes bed rest, hydration, and analgesics. An epidural blood patch may be required if conservative measures fail. 7. Nausea and vomiting. Complication. Regional anesthesia, particularly spinal anesthesia, can trigger nausea and vomiting. Management. Prophylactic antiemetics can be administered before or during the procedure. Treatment with antiemetics is indicated if nausea or vomiting occurs. 8. Pneumothorax. Complication. Rarely, during interscalene or supraclavicular blocks, the lung can be punctured, leading to a pneumothorax. Management. Immediate recognition and management with chest tube insertion is essential in case of pneumothorax. 9. Allergic reactions. Complication. Although rare, allergic reactions to local anesthetics or additives can occur. Management. Treat allergic reactions with antihistamines, corticosteroids, and epinephrine as necessary. Avoidance of the allergen in future procedures is crucial. It's essential for healthcare providers performing regional anesthesia to have a thorough understanding of potential complications and be prepared to manage them promptly and effectively to ensure patient safety and optimal outcomes. Additionally, informed consent should always be obtained from the patient, explaining the risks and benefits of the procedure and potential complications.